Sarcopenia is the loss of muscle and strength that can happen when someone gets older and does less physical activity. Sarcopenia plays an important role in the loss of daily functions that help you remain independent. Losing muscle mass can begin as early as age 30, and the rate of decline accelerates around age 60, which is when this decline can become especially noticeable in day-to-day life. The U.S. Department of Health and Human Services Office on Women's Health developed the Stronger Than Sarcopenia campaign to build awareness of sarcopenia and highlight ways to address it to help women stay stronger longer. Hormonal changes associated with aging, including decreased estrogen levels that occur during menopause, play a significant role in the accelerated decline caused by sarcopenia. To explore how menopause and sarcopenia are connected, the Office on Women's Health invited Jenna Perkins, a board-certified women's health nurse practitioner serving Washington, D.C., Maryland, and Virginia, to share her insights.
Hormones are simply just the way that your body delivers messages. So hormones tell your muscles to build and keep you strong. They tell your bones to work properly. They tell your eyes, your skin, every single part of your body has hormone receptors there. When we talk about menopause, it is about a decade-long transition and loss of hormones. And so with that, everything from your hair to your skin, to your nails, to your muscles, to your blood pressure changes because these hormones change. So estrogen in particular is a hormone that does a lot for the body. And so we'll start with what it does for the heart. Estrogen keeps the blood vessels that pump your blood all over your body. Estrogen allows it to be elastic. So if you think about like having a balloon and you try to blow a balloon fresh out of the packet, right? And you do that first breath and you're like, oh my God, why is this so hard to do? And then you have to stretch the balloon a little bit to give it a little bit of elasticity. It needs that stretch. And so when we have estrogen loss, we lose that stretch. And so the blood vessels become stiff. And that is where we can have a situation where heart disease starts to set in place. One of the other things that estrogen is in charge of is how our muscles act. One of the things I love to teach people about is that your muscles actually need glucose or sugar in order to work properly. And so estrogen works kind of like a conductor to help insulin to get the blood glucose into the muscle cells to allow them to have the energy that it needs. If the muscles are not getting the energy that they need, then they cannot work properly. So when we're talking about sarcopenia, this is the process that we are talking about. Hormone loss with the perimenopause and postmenopause transition directly affects your body's ability to maintain muscle mass. Even if you are not a woman, even if you are not perimenopausal or menopausal, if you are over the age of 30, we know that you are going to lose muscle mass. So we add insult to injury when we no longer have the hormones, specifically estrogen, that we are talking about today. So this perimenopause transition can greatly increase your risk of hypertension and also muscle loss, weight gain, and all of the other changes that put you at risk for the #1 killer of women, which is heart disease. Hot flashes, night sweats, vaginal dryness, sexual dysfunction, all of these are things that women may think are bothersome in menopause, but they are also signaling that something deeper is going on. And so we should really pay attention because we have to be heart focused at all times when we think about women's health.
As a reminder, for some women, treatment options such as hormone replacement therapy, also called menopausal hormone therapy, may be considered to help manage certain menopause symptoms and support overall health during this transition. Decisions about hormone replacement therapy should always be made in consultation with a healthcare provider who can discuss the potential benefits and risks based on your personal health history. If you are experiencing menopause symptoms or noticing changes in your strength or muscle health, it may be helpful to talk with your healthcare provider about the full range of options available, including lifestyle changes, exercise, nutrition, and whether hormone replacement therapy might be appropriate for you. It is never too late to start focusing on your muscle health so that you can maintain our independence and do the things that you love for as long as possible. If you have noticed a change in your ability to do certain activities, your overall strength, or your endurance, it is important to discuss this with your healthcare provider. They can determine your risk for sarcopenia, screen you for signs of muscle loss, and work with you to create a plan for exercise and nutrition that is best for you. Remember, you are stronger than sarcopenia. To learn more, visit womenshealth.gov/sarcopenia.